What do you mean by basic life support? What are the components inside the BLS you are going to learn? That is what my question is. So when you say BLS, what are the things you are going to learn? CPR, very good. So the basic life support is all about how are we going to do a high quality CPR. Understand? What is CPR? Means when are you going to do CPR? When the patient is unresponsive and when his heart stopped, right? So we are artificially going to make the heart to pump. Yes or no? So that is called CPR. So today you are going to learn CPR in 3 different age group. What are the 3 different age group we know? Adult, children, very good. Who is adult? Above 18, is it? So that is only for voting, right? That is only for voting, right? So here when we discuss about BLS, an adult means those who attained puberty. Understand? Those who attained puberty are known as adult in BLS. Did you all understand? Guys, are you following me? Yes, is my voice clear to you? Yes, right. What do you mean by adult? Those who attained puberty are known as adult. So how do you know a male attained puberty? How do you know that? How do you know whether a male attained puberty or not? What is it? But your patient may be unresponsive, right? In cardiac arrest he may be unresponsive. Can you hear his voice? So, then give me an answer. Is there a change that happens in the body other than the voice in males? Hair growth, very good. So whenever you have a person with an underarm or chest hair growth, he is considered as an adult. Did you all understand that? Yes or no? Yes. So whenever you see a victim or a patient with underarm or chest hair, they are considered as an adult, no more a child. Guys, did you understand? Yes, so who is a child then? Then who is a child? Who is considered as child? From which year? 5 year? 1 year, very good. From 1 year until puberty. Understand? From 1 year until puberty is considered as a child. After puberty considered as a? Now from 0 to 28 days, what is they called? 0 to 28 days are? Newborn. So from, see, from 1 month to 1 year, they are infants. Did you all understand? So until 28 days it is a newborn, then 28 days or a 1 month to 1 year is an infant, from 1 year until puberty is child, after puberty is. So here you are going to learn adult, child, infant. In these 3 age group, how are we going to recognize cardiac arrest? Understand? How are we going to recognize cardiac arrest and how are we going to manage it? You got an idea about what are we going to learn? Yes or no? So we start with the adult. Understand? Now tell me, who is considered as an adult? After puberty. Very good. Now, what is the criteria for cardiac arrest in adult? When are you going to say that he is an adult and he is in cardiac arrest? What is the criteria to say that the person is in cardiac arrest? First criteria, like ma'am said, first criteria is the person may be unresponsive. Understand? What is the first criteria? Unresponsive patient. Then if the heart stops, there is no pulse. Understand? And if there is no pulse, no breathe as well. Understand? So what is the criteria for cardiac arrest? Unresponsive, no pulse and no breathe. Then you say it is a cardiac arrest. So now let me ask you one thing. Do you think the cardiac arrest happens only in the hospital? No, anywhere the cardiac arrest can happen, right? Maybe in the road, maybe in a railway station, maybe in the bus. Anywhere anybody can be getting arrested. So remember, whenever you are going to manage a cardiac arrest, the first thing you think about your safety. Understand? Always our safety comes first. So what you need to think of? The first step, you check the scene for safety. Means what? See, if a patient or if a victim is unresponsive in the middle of the road, do you think you can easily give CPR in the middle of the road? What will happen then? You will have an accident, right? Yes or no? So what you need to do? Scene safety. So always, always, always remember, the first step in the BLS or before starting CPR, the first step is check the scene for safety. What is it? Check the scene for safety. Second, what you are going to do? What is the first criteria? Check the response. Second is you are going to check the response. How do you check the response, guys? Tap on where? Yeah, you are going to tap on both shoulders and shout, "Sir, madam, are you okay? What happened?" Understand? So with the two hands you are going to tap on the both shoulders and shout. Do you think if he is in cardiac arrest, he is going to respond or unresponsive? See, he is unresponsive. What is your next step? Call for help. Call for help. What was the first step? Scene safety. Second? How did you check the response? If he is unresponsive? Call for help. Then what you are going to do? Check the pulse and breathe. Always check the pulse and breathe. In adult, which pulse are you going to check? Carotid pulse. Why only carotid? Why can't you go and check the radial pulse? Is it because of that? So why do you check only carotid and not radial? So it is very easy for you to check the radial pulse. No. What do you ask? I forgot Tamil now. In between, when I start to talk, it may come out, otherwise. So did you understand my question? So why you are only checking carotid, not the radial or other pulse? That was my question. Anybody? See, remember one thing, guys. If you check the radial pulse, if the BP is less than 80 or less than 90 systolic, you may not get the radial pulse. Understand? If the BP is going down, like after an accident, the patient comes to the emergency department and he has a blood loss of 2 liters. Do you think you will get this pulse? No, you will not get the radial pulse if the BP is going down. It doesn't mean that he is in arrest. Purida, what did you understand? So if this pulse is absent, it doesn't mean that he is in cardiac arrest. Maybe the BP has gone down. That is why he has no pulse. But if this pulse is gone, what does it mean? The heart is stopped. Guys, did you understand the point? Yes or no? Everyone at the back? I will surely going to ask you questions. Okay? So what was the first step then? Second? How did you check the response? If he is unresponsive, then what you are going to do? Which pulse? Along with pulse, you are going to check the breathing as well. Understand? How do you check the breathing? You just look at the chest of that victim, whether it is moving or up and down, right? But there is no breathing. What is the condition of the patient? The person is unresponsive. Now he has no pulse, no breathe. What is the condition now? Cardiac arrest. What you will do now? You need to start CPR. Very sure. But before that, what do you need to do? See, if you have a code blue, you all are going to work in the hospitals, right? Now many of the hospitals, they have a code blue system. Did you ever heard of it? What do you mean by code blue? Alerting the system for cardiac arrest. Understand? So in your hospital, if you have a code blue, you will ask somebody to activate the code blue. Understand? Yes or no? Yes. Then you start the CPR. After activating the code blue, immediately you start the CPR. Clear now? Now, if you don't have a code blue, like you are at home and somebody collapsed and he is in cardiac arrest, do we have a code blue at home? So what you will do? Call the ambulance. Understand? So any emergency response system should be activated. Whatever is available in your place, if it is an ambulance, call the ambulance, right? If it is in the hospital which has a code blue, you activate the code blue. Did you all understand? So what are the steps? Tell me. Scene safety, check the response, call for help, check the pulse and breathe. No pulse, no breathe, you activate the code blue or you activate the emergency response system and get an AED. Understand? Now my question is, how long are you going to check the pulse and breathe? How long? How much time you are going to check the pulse and breathe? Very good. 5 to 10 seconds. Only 5 to 10 seconds. Minimum of 5, maximum of 10. Understand? So you check the pulse and breathing for at least 5 seconds, but not more than 10 seconds. 5 to 10 seconds you check the pulse and breathe. Are we clear about the assessment part, guys? Everyone? Right. Now, as I told you, as soon as possible you are going to start the CPR. What do you mean by CPR? Means what? Cardiopulmonary resuscitation. Cardio means anything related to heart. Pulmonary means anything related to lungs. So you are going to resuscitate both heart and lungs. Simple as it is. Right? What is the function of the heart? Pumping blood. So here his heart is not pumping. So you are artificially pumping the heart. What is the function of the respiratory system or the lungs? Exactly, breaths, gas exchange, right? Here it is not working, so you are going to artificially give him the breaths. So that is called a CPR. Understand? Now whenever you think about CPR, you have 3 components. You have three components. What are the three components? One is C stands for compressions. What is the first thing you do? You are going to do the compressions. Why you need to do the compression? You are making the heart to pump. Understand? Then A. What is A stands for? Airway. Then B. What is B stands for? So that is CPR. Compressions, airway, breathing. Understand? Compressions, airway, breathing. So you are going to initially start the compressions, then open the airway and deliver 2 breaths. Now the focus is on compression. Now we are going to learn how to do the compressions. Right? Now you are going to use your hands for doing the compressions. So which part of your hand you are going to use? Oh, not the palm. That is why I asked. Always use the, I have only 2 hands. It's okay. So you are going to use the heel. Got it? Heel means what? This part. Okay? So you are going to use the heel of the hand. Where are you going to place the heel of the hand? In the lower half of the sternum, not in the middle part of the sternum. In the lower half of the sternum. Understand? So you are going to place the, which part of the hand? Heel of the hand. Where? Lower half of the sternum. It is here or here? Lower part. Understand? Now what is the rate of compression? How speedy you do the compression? Rate? 100 to 120 per minute. How much is it? 100 to 120 per minute. Rate how much? Tell me rate. 100 to 120 per minute. Means what? Minimum you need to give 100 compression per minute or maximum up to 120 per minute. What is the depth? How much deeply you go? 2 to 2. That wrong. 2 to 2.4 inches. You will never go up to 2 to 2.5 because 2.5 is above 6 centimeters, and when you go above 6 centimeters, you are going to damage the internal structures. So what is the depth you give? 2 to 2.4 inches. How much is it in centimeters? 5 to 6. 5 to 6. So what is the rate I said? What is the depth? 4 inches or centimeters? 5 to 6 centimeters. Now what is the compression ventilation ratio? How many compression, how many ventilation? 30 compression followed by 2 breaths. So 30:2 is the compression ventilation ratio. Understand? So what is the rate? What is the depth? How much in centimeters? What is the compression ventilation ratio? Understand? And remember, whenever you are doing compression, allow chest recoil. What do you mean by chest recoil? Chest recoil means what? So when you compress, the chest is going down, right? Now it has to come back to the previous position. Yes? Why you need to do that? Why you need to allow chest recoil? Because when you compress, all the blood has pumped out. Illaya. So when you press, all the blood in the heart has pumped out. Now it has to refill, then only the next compression. Guys, did you understand what I said? Yes? So if you want to have adequate chest refill or the heart to refill, you will always allow chest recoil. Understand? And every 2 minutes, you are going to change the compressors. Why? Why every 2 minutes you need to change? Why? See, I was doing for the 2 minutes. Now I must be tired, Allah. Yes or no? So once I am tired, I will not be able to do a high quality CPR again. Purida. What do you ask? Purida. Correct? Huh? Okay. Yes, you got it? So within 2 minutes, when you start CPR, after 2 minutes, you are doing the compression and you must be tired. So after 2 minutes, what I will do? I will ask somebody else to come and do the compression. Clear? Yes or no? Right. Now can we stop the compressions in between? Can we stop it in between? No. Okay. So I want to deliver shock to the patient. So one person, madam was doing the compression. Now I want to deliver shock. If I deliver shock when she is doing compression, what will happen? She will also get shock. So I need to ask her to stop the compression before delivering the shock. So can we stop compressions? Yes or no? Yes, because I cannot shock madam as well. I want to shock only the patient, not madam. Do I need to kill her or what? Huh? Did you understand my point, guys? So you need to stop the compression in between. When are we going to stop? See, I given 30 compression. Now I have to give breath, right? I will stop the compression and deliver the breaths. Yes or no? So while delivering breaths, I may stop the compression, right? While delivering shock, I may stop the compression. While I call somebody else to do the compression, then also I will stop the compression. So I need to stop the compression in between. I cannot do continuously. Understand, guys? But remember, the maximum interruption should be less than 10 seconds. Did you understand that? So means what? Guys, are you understanding? So what is the maximum interruption you can allow? 10 seconds. So if I stopped after 30 compressions, I give 2 breaths within 10 seconds. Then come back to the compression. You got it? If I stop for delivering shock, within 10 seconds, I delivered the shock, restart the compression. So only 10 seconds you are allowed to stop the compression, not more than 10 seconds. Because if you are allowing more interruptions, survival chance of the patient is going down, right? Yes or no? So always make sure that you minimize the interruption. Are we all clear? Yes or no? So these are the components in your compressions.